Hey all, so this is the short podcast on the video I posted a day or so ago and thought I would go over it quickly. So you can see that this is kind of a backwards peristernal long axis. They have the ultrasound set up for fast exam or abdominal setting, which is it's okay. Most cardiacs are on the right side of the screen here. But what you have to do if you have it set up over here is you have to have the probe indicator down towards the patient's left hip. And it appears that they kept this probe indicator towards the patient's right shoulder, which would be appropriate if the indicator was here on the left-hand side. So basically the heart is just flipped around and is kind of pointing in the right direction. So you can see the pericardial effusion here. This is the RV up here, and you can see, and I'll go over it again with some drawings, a little man jumping on the ventricle right here. If you watch that area. So if you watch that area, you can see him right there. Just imagine a little man jumping. You see how that RV wall is going down. And this right here is your aortic valve, aortic outflow tract. Here we start this. And right here is mitral valve. That's left atrium, left ventricle. This is the descending aorta right there. And you can see this fluid, which is superior to the descending aorta, tells you that it's pericardial. You can see down here that, is this a pleural effusion? It looks like an anechoic area. But then you can also see right here, this is beating. Why would it be beating? So is that a mirror image and it's just artifact? Or is it really a pleural effusion along with it? And of course, to rule that out, it's a simple thing to do. Just pop the ultrasound probe in the as if you were doing a fast exam and go superior a little bit on the side of the patient, and you can find the diaphragm and then see if it's actually a pleural effusion or not. So anyway, I will get a still up here and do a little bit of drawing. So you can see here, this is the pericardial effusion. All this dark anechoic area is fluid. That's all effusion. And you can see here, this is the RV right here. And you can see right here is where the little man's jumping. That's where the RV free wall is collapsing. And I would call this a tamponade, and I'm sure the patient is starting to show clinical signs, and if he's not, he will be shortly. This is your mitral valve right here. This is aortic valve, that's aortic outflow tract. And this is LV. This is your left atrium. And this is your descending aorta. Right here, this dark anechoic area here is the question. Is that also a pleural effusion, or is it just mirror image of this area in here? And of course, to do that, it's like I said before, it's a simple thing. Just put your probe on the patient's left or right side and move it up a little higher than you would for a fast exam, and check the diaphragm and see what's above the diaphragm, and it'll be a simple matter to rule that in or out. So anyway, this is a peristernal long axis. Of course, the heart's turned the opposite way just due to the way the probe indicator is being turned to, but it still gives you enough information, obviously. Hope you enjoyed this podcast. If you have any questions, please post them. Thanks.